My name is Jillian Stone. I'm going to be Joshua Stone's patient this week, and I give him permission to video record me during this video.
Alright, knock. Hi, my name is Josh. I'm going to be your nurse today. I'm here to take a head to chest assessment. It should take about 15 minutes. I'm going to need to ask you a few questions. Is that okay?
Yeah.
Alright. Close the curtain for privacy. Hand hygiene. Can I see your bracelet? Can you give me your name and date of birth?
Jillian Stone, 9/29 of 89.
Alright. So, my patient is not in any signs of acute distress. Are you in any pain?
Nope.
Are you allergic to anything?
Mm-mm.
Alright. Mind if I sit down? Alright. Can you tell me what month it is?
June.
Can you tell me where you're at?
The clinic.
Can you tell me who the president is?
Donald Trump.
Alright, so my patient is alert and oriented ×4 to person, place, time, and situation. My patient's mood and affect is appropriate for the situation. Their behavior is appropriate for the situation. Their dress is appropriate. Their speech is clear. And their hygiene is good. Moving on to your head. Your head is normal cephalic with symmetrical facial features. Nose is midline. You're not showing, you don't have any lesions, wounds, infestation, or incisions. Your skin's appropriate for your race. Going to feel your skin. Your skin is warm and dry. In your head, there's no signs of any lesions or infestation. Moving on to your eyes. Your hands. They are pink. No clubbing. And the cap refill is within 2 seconds. Moving on to your eyes. Your eyes, the sclera is white. Your conjunctiva is pink with no redness or drainage. I'm going to pull out my pen light here. I'm going to shine it in each one of your eyes. Alright, and can you follow my pen light with just your eyes only? Alright, and can you tell me what that picture over there says?
God bless this home.
Alright, so my patient would be considered parallel. Pupils are equal, round, reacted to light, and show accommodations at 4 millimeters. Moving on to my patient's ears. There's no drainage, no redness, no swelling in either ear. My patient has been able to follow my commands thus far, so my patient has no hearing loss. Moving on to your nose. I'm going to shine my pen light up there. Alright, so I see no deformities, asymmetrical turbinates, or no signs of inflammation. Can you take your right hand to your right nostril and blow out? Now your left one. Alright, so nares are bilaterally patent with no signs of drainage. Moving on to the mouth. My patient's lips are pink and moist. Can you open up your mouth for me? Alright. Patient's gums are pink and moist, and can you stick out your tongue? Alright. My patient's tongue is pink and moist. Alright. Moving on to my patient's heart. Normally, in order to check for JVD, you would raise the head to a 45-degree angle and lay your patient back. In order to check for JVD, can you turn your head to the left for me? Alright, and then can you turn your head to the right? Alright, so there's no signs of JVD. I'm going to palpate your carotid. Carotid pulse is at a 2+. I'm going to palpate your radial. Radial pulse is at a 2+. I'm going to listen to your heart sounds with my stethoscope. Alright, so the second intercostal space, right sternal border is your aortic. Second intercostal space, left sternal border is your pulmonic. Third intercostal space, left sternal border is your herbs. Fourth intercostal space, left sternal border is your tricuspid. And can you lift your right breast for me? And the fifth intercostal space, midclavicular, is your mitral. And then I'm going to listen with my bell. So this would be the aortic, the pulmonic, herbs, tricuspid, and then this would be the mitral. I would also like to note that you would listen over bare skin and not over clothing for all these. Moving on to lungs. I noticed that my patient is not using any accessory muscles in order to breathe. I am going to auscultate your lungs, and each time that I move my stethoscope, or the diaphragm of it, I need you to breathe in and out for me. Okay, take a deep breath. Alright, so this is and you would also do this over bare skin. So this is your right upper lobe. This is your left upper lobe. Alright, and then this is your right lower lobe. Then this is your left lower lobe. Alright, and then can you lift up your right arm for me? This would be your right upper lobe. This would be your right middle lobe. And then your right lower lobe. Okay, and then can you turn to your side for me so that way you can show your back. And this would be your left upper lobe. Right upper lobe. Alright, this would be your left lower lobe. Alright, breathe again. Right lower lobe. Breathe. Left lower lobe. And the right lower lobe. Alright. So, are you showing on any pain?
Nothing.
Alright, can I offer you anything, like a pillow, blanket? Anything?
Nope, I'm okay.
Alright, you would lower the bed all the way to its lowest position. You would raise the two top head rails all the way up, and then put the bed in its lock position. Hand my patient a call light. Thank you for your time, and hand hygiene on the way out.